Welcome to the deep dive. Today, we're zeroing in on pneumonitis. Now, that might sound like one specific disease, right? But what if I told you it's more like your body waving a red flag, signaling inflammation in the lung tissue? We've gathered a wealth of information to help you not just understand what pneumonitis is, but, why it matters and what it could mean. Our mission today is really to unpack this complex topic into clear, digestible insights.
Exactly. Think of pneumonitis as a signpost, maybe, on the road to understanding various lung conditions. It's not the destination itself, but it tells us something important is happening in the lungs. We'll be exploring the different paths that can lead to the signpost, the causes, and how this inflammation actually impacts the delicate workings of the lungs, and crucially, what other conditions might present in a similar way. By the end, you should have a much clearer picture of this important concept.
Okay, so let's start right at the beginning. Yeah. In simple terms, what is pneumonitis?
Well, at its heart, pneumonitis is inflammation of the lung tissue. Now, inflammation itself isn't always bad. It's the body's, natural response to injury or irritation. However, when this inflammation becomes chronic, ongoing in the lungs, that's when it can unfortunately lead to irreversible scarring. We call that pulmonary fibrosis. And it's really vital to remember that pneumonitis is usually a reaction to something else. It's not really a standalone disease. It's your lungs saying, hey, something's not right here.
That makes sense. Okay, so if we think about a sudden, intense trigger, like someone being exposed to a really strong chemical, what happens then?
That would likely be acute chemical pneumonitis. Imagine the delicate lung tissue suddenly encountering a harsh irritant, like, say, chlorine gas. The immediate response is swelling, and you get fluid moving into the tiny air sacs, the alveoli, where all the important gas exchange happens. This flooding of the air spaces drastically reduces the lungs' efficiency. They can't get oxygen in or carbon dioxide out properly, and in severe cases, this can lead to a dangerously low level of oxygen in the body, a condition known as hypoxia. It's a very rapid and serious reaction.
Wow, yeah, that paints a vivid picture. Now, what about the other side of things? When the exposure is less intense, maybe, but happens over a longer time, how does chronic pneumonitis develop?
Right. Chronic pneumonitis often comes about from repeated exposure to lower levels of an irritant. This could be over months or even years. This ongoing sort of low-grade irritation keeps that inflammatory process simmering away in the lungs. And over time, this persistent inflammation can trigger the laying down of scar tissue. That's the fibrosis we mentioned earlier. As this scar tissue builds up, the lungs lose their elasticity. They become stiff, making it harder to expand and contract with each breath. This stiffness directly impairs the exchange of gases, obviously. And unfortunately, if it progresses far enough, it can eventually lead to respiratory failure.
Okay, so we understand the what. Now let's get into the why. What are some of the common culprits? What triggers this inflammation in the first place? What's the etiology?
Well, there's a really diverse range of potential causes. Some might seem familiar, like pneumonia, that's an infection directly inflaming the lung tissue. Then we have aspiration pneumonitis. That happens when someone accidentally inhales foreign material, most often stomach contents during vomiting. Yeah. And even whooping cough pertussis can sometimes lead to pneumonitis. You could maybe think of pap pneumonia, aspiration. Pertussis is some initial infectious triggers, perhaps.
Okay, Pepe, got it. So infections are one big category. What else can set off this inflammation?
Another really important category is hypersensitivity pneumonitis. Think of this as your lungs having an an overreaction to inhaled substances. Common examples include humidifier lung from molds and damp spots, farmer's lung from moldy hay, and bird fancier's lung from proteins in bird droppings or feathers. It's your own immune system basically going into overdrive in response to these things you might breathe in. And beyond what you inhale, pneumonitis can also pop up as a feature of certain connective tissue diseases like rheumatoid arthritis or lupus.
That's fascinating. The body kind of attacking itself in a way. Are there other, perhaps more external factors?
Oh, absolutely. Adverse reactions to certain medications or exposure to toxic chemicals are also significant causes. Lots of household and industrial chemicals can irritate the lungs. We mentioned chlorine gas. But other culprits can include fumes from things like smelting, welding, or even certain solvents and pesticides. Even events like fires or handling grain can expose you to inhalational irritants. And then there's a range of medications. Interferon therapy, the heart drug amiodarone, the antibiotic nitrofurantoin. They've all been known to sometimes cause pneumonitis as a side effect. Oh, and let's not forget radiation therapy to the chest area. That can also inflame the lung tissue that's been treated. And finally, sepsis, where the body's huge inflammatory response to a severe infection can also hit the lungs.
Wow. Okay, that's a really extensive list of potential triggers. It covers a lot of ground. So given all that, are there specific things that might make someone more susceptible? Are there identifiable risk factors we should know about?
Well, it's interesting. Our source material doesn't break out risk factors as a totally separate section from the causes themselves, but we can definitely connect the dots. For instance, people whose jobs involve regular exposure to dusts, fumes, or chemicals.
Like farmers, welders.
Exactly. Farmers, metalworkers, construction workers, they're clearly at a higher risk for the types of pneumonitis linked to those specific exposures. And similarly, individuals getting radiation therapy to the chest are, by definition, at risk of radiation pneumonitis. What's also interesting is that the risk and severity of that side effect, the radiation pneumonitis, can be influenced by things like older age and having other health conditions already. So while not a distinct list, the causes themselves often point directly to the at-risk groups. If bird exposure is a cause, bird owners are at risk. Right.
That makes perfect sense. Yeah. The cause implies the risk. So now we know what can cause it. Let's delve into the how. How does this inflammation actually, well, mess with the lungs' ability to do their job? What's the underlying pathophysiology?
Right. The core issue, as we've said, is that inflammation within the lung tissue itself. In an acute situation, this inflammation leads pretty quickly to swelling of the lung tissue and leakage of fluid right into the alveoli. You know, those tiny air sacs where the magic happens, oxygen in, CO2 out. This fluid and swelling basically act as a barrier. It physically hinders the efficient transfer of those gases.
Okay.
In chronic cases, it's a bit different. The persistent inflammation sets off this whole cascade of cellular events that can lead to fibrosis, which means specialized cells start laying down excessive collagen, that's scar tissue, within the lung structure itself. This scar tissue stiffens the lungs, reduces their elasticity. Imagine trying to inflate a balloon made of stiff leather instead of flexible rubber. That's kind of what happens.
Yeah.
And the stiffness directly impairs their ability to expand fully and ultimately exchange gases effectively over the long term.
So it really gums up the works, so to speak.
If someone comes in then with breathing difficulties and a cough, how do doctors tell pneumonitis apart from all the other things it could be? What's the differential diagnosis look like?
Yeah, that's a critical step because the symptoms, especially with chronic forms, can really overlap with many other lung conditions. Doctors have to consider a pretty broad range of possibilities. Chronic pneumonitis can be easily mistaken for other progressive lung diseases. Idiopathic pulmonary fibrosis is a prime example.
Right.
So when evaluating someone with persistent respiratory symptoms, maybe some odd things on their lung scans, doctors have to systematically think about and rule out other potential causes. That could be acute, subacute, or chronic issues causing breathing problems or a cough. This includes various infections, things like Legionnaire's disease, Q fever, even tuberculosis, other inflammatory conditions like sarcoidosis, which can affect multiple organs, including the lungs.
Yeah. And even, unfortunately, malignancies like lung cancer need to be carefully considered and ruled out. It's like being a detective, really. You have to gather all the clues to pinpoint the right culprit.
It sounds like a thorough workup is absolutely essential then to get the right diagnosis. Speaking of how common it is, what does the epidemiology tell us? How widespread is pneumonitis?
Well, if we think about pneumonitis not as one single disease, but as this reaction with many potential causes, it's actually quite common overall. If
Wow.
you look specifically at interstitial lung diseases in England, which is a group that includes many forms of pneumonitis, there are roughly 2,000 to 4,000 new diagnoses each year. Now, conditions like sarcoidosis and idiopathic pulmonary fibrosis make up the bulk of those, but hypersensitivity pneumonitis still contributes significantly. It accounts for somewhere between, say, 4% and 15% of reported interstitial lung disease cases. It's important to realize, though, that the exact numbers for hypersensitivity pneumonitis can vary quite a bit. It depends on how strictly it's defined, the specific geographical area you're looking at. Even local farming practices can influence it.
Interesting.
And we also know, going back to radiation, that the risk of developing side effects like pneumonitis isn't just about the dose. Patient factors like older age and other existing medical conditions, comorbidities, they also play a significant role.
Okay. So if someone were to develop pneumonitis, what kind of symptoms might actually prompt them to see a doctor? What are the typical clinical features? How does it present?
A really crucial piece of the puzzle for doctors is often a detailed history. They need to know about any potential exposures, so they'll ask specifically about contact with birds, any history of radiation treatment to the chest,
Right.
exposure to various dusts or molds, maybe at home or work, any medications they're taking, or chemicals they might have encountered. The actual symptoms can vary quite a bit depending on how quickly it develops and what's causing it. Common initial symptoms often include shortness of breath, especially when exerting oneself, and a persistent cough. Some people might also feel a sort of burning sensation in their chest.
Mm.
In cases of chronic pneumonitis that develop more gradually, you might see more insidious symptoms creeping in. Things like persistent fatigue, maybe losing weight without trying, a decreasing ability to exercise, cyanosis, which is that bluish tint to the skin indicating low oxygen,
Uh-huh.
and even finger clupping, which is a physical sign you can sometimes see with chronic lung disease.
And how do doctors go about confirming it then? Once they suspect pneumonitis, what kind of investigations are usually involved?
There are several key investigations they'll likely turn to. Blood tests can offer valuable clues. A full blood count, or FBC, might show changes in white blood cells, maybe more neutrophils, lymphocytes, or eosinophils, depending on the cause. Inflammatory markers in the blood, like ESR and CRP, might also be up.
Right, the inflammation marker.
Exactly. An arterial blood gas test, which measures oxygen and CO2 levels directly in the blood, often shows hypoxemia that's low blood oxygen. If an infection is suspected, they might collect a sputum sample or sometimes get fluid via bronchoscopy.
That's the camera scope.
Yes, where a small camera goes into the airways. That sample can be sent for culture to identify any bugs. In suspected hypersensitivity pneumonitis, specific blood tests looking for serum precipitating antibodies against those inhaled allergens can be quite helpful. Imaging is also absolutely crucial. A standard chest x-ray might actually look normal, especially early on, or it might show subtle things like tiny spots, micronodules, or maybe some web-like patterns, reticular opacities. But a CT scan of the chest is generally much more sensitive. It can reveal a wider range of findings, things like diffuse or patchy ground glass opacities, these hazy areas that look a bit like frosted glass,
Ah,
small, poorly defined nodules, patchy areas where air seems trapped, and in the chronic or more advanced cases, you'll see evidence of that pulmonary fibrosis, sometimes including a honeycomb pattern on the scan. Pulmonary function tests, PFTs, like spirometry measuring how much and how fast you can breathe out, often show restrictive changes. That means the lungs can't expand fully. And interestingly, the lungs' ability to transfer gas from the air sacs into the blood, the gas transfer, is often reduced as well. And then, in some tricky situations, if the diagnosis is still uncertain after all that, a lung biopsy might be needed. That's where they take a tiny sample of lung tissue to examine under a microscope.
wow, that's a really comprehensive diagnostic process. Lots of pieces to put together. So once a diagnosis of pneumonitis is made, what's the typical management approach? How is it treated?
Well, the absolute most critical first step in managing pneumonitis is to identify and then completely avoid whatever the precipitating cause is, if possible. If it's linked to something in the environment, like mold at home or work, that exposure needs to stop.
Makes sense.
If a medication is the culprit, it might need to be stopped or switched. Beyond just avoidance, the treatment really depends heavily on the underlying cause. For hypersensitivity pneumonitis, for instance, systemic corticosteroids like prednisone can often be very effective. They help reduce the inflammation and speed up recovery.
Okay.
If the pneumonitis is actually due to an infection, like bacterial pneumonia, then naturally antibiotics are the main treatment. And while they aren't a direct cure for all types, there are antifibrotic medications showing some promise in slowing down the progression of idiopathic pulmonary fibrosis, which, as we know, can be a long-term consequence of chronic inflammation.
Right. And thinking about the long term, what can someone generally expect after being diagnosed? What's the overall prognosis like?
Generally speaking, the prognosis for pneumonitis is often quite good. Especially if it's diagnosed early on, the underlying cause is found and properly addressed, and that inflammation is managed effectively. However, and this is important, if chronic pneumonitis goes undetected for a while or is diagnosed late, that ongoing inflammation can lead to the development of progressive and irreversible lung scarring, that pulmonary fibrosis we keep mentioning, and that, unfortunately, can carry a more guarded prognosis.
Okay, so early detection is really key. Are there any potential complications that can arise down the line as a result of having pneumonitis?
Yes, there are several potential complications to be aware of. Some individuals might experience quite severe acute or subacute flares of their pneumonitis. These can cause significant respiratory distress and, in some cases, can actually be life-threatening. There
Hmm.
might also be an increased risk of getting recurrent pneumonia. In rare instances, pneumothorax, which is a collapsed lung, can occur. As we've discussed quite a bit, pulmonary fibrosis is a major potential long-term complication, especially of the chronic forms. Another serious one is cor pulmonale. That's a type of right-sided heart failure that develops because the chronic lung disease puts a big strain on the heart over time. And finally, in some cases, that chronic inflammation from pneumonitis might contribute to the development of chronic obstructive pulmonary disease, or COPD.
So pulling it all together then, the key takeaway seems to be that pneumonitis is the sign of lung inflammation with a really wide array of potential causes. And the long-term outcome can vary significantly, really depending on spotting it early and managing that underlying trigger effectively. It definitely underscores the importance of being aware of potential environmental or occupational exposures, doesn't it?
Mm,
And seeking medical attention for any persistent or concerning respiratory symptoms.
absolutely. Recognizing those diverse triggers and understanding that persistent lung symptoms always warrant investigation that's crucial for timely intervention and hopefully getting better outcomes.
Well, this has been a truly insightful deep dive into pneumonitis, really helpful for those of you listening and looking for more resources, perhaps to support your MSRA revision. Don't forget to check out pastthemsra.com and also freemsra.com. Thanks so much for joining us on the deep dive.